So thank you so much for joining us and welcome to Madison VA Hospital's live Teletown Hall. My name is Jim Bove. I'm the Public Affairs Chief at the hospital, and I'll be moderating this afternoon's call. We have a panel of Madison VA's leadership team here to provide program updates and answer your questions. We'll share a lot of information about resources and services, so we highly suggest having a pen and paper close by so you can write them down. We will typically always repeat phone numbers and websites, so if you don't get it the first time around, just hang tight for us to say it again. We encourage you to participate in the question and answer session at the end of the call. To ask a question, just press 0 on your phone, and you'll be connected with staff who will take your question and get you into the queue to speak with our panel during the Q&A session. We usually don't get to all the questions, but you'll have the opportunity to leave a voicemail at the end of the call so we can follow up. If for some reason you can't stay for the whole call, we'll also post this call on our website over the next week or two. If you aren't in our Wisconsin and Illinois catchment area and you're wondering why in the world am I getting invited to a Madison, Wisconsin town hall, we randomly call 10,000 veterans who have received care at the Madison Hospital or any of our clinics in Wisconsin or Northern Illinois, so you likely paid us a visit at some point in the last year or two. Feel free to stay on the call with us, but do know that your local site may have different information for certain topics. With that said, as always, we like to start our call with a message from our leadership. And joining us today is our Executive Director, Christine Kleckner. Welcome, Ms. Kleckner.
Thank you, Jim. Good afternoon, and thank you so much for taking time to join us today. If you haven't heard, we proudly inducted a new veteran into our Hall of Heroes a few weeks ago, U.S. Army Staff Sergeant Thomas Hack, who received a Silver Star and a Bronze Star while serving in Vietnam. We were able to honor him along with his family and several of our other past Hall of Heroes inductees who were in attendance. If you have someone you'd like to nominate for our next Hall of Heroes selection cycle, we encourage you to visit our Hall of Heroes website where you can find the criteria and the application. To be considered for our next selection cycle, we must receive nominations no later than September 1st. It can take time to gather necessary military records, so if you are thinking about nominating someone, we encourage you to start that process now to have it completed in time. As we get into the summer, we have several events to look forward to. You'll be hearing about this more later in the call, but we're hosting an open house at our Beaver Dam clinic on Friday, June 26th from 11 a.m. to 2 p.m. For those in the Janesville area, we'll be hosting an open house at our Janesville clinic on Friday, July 24th from 11 a.m. to 2 p.m. If you're near either clinic, please stop by and see us, and please consider bringing your fellow veterans with you, especially if they aren't receiving their care through VA. If weather cooperates, we'll have free brats on the grill waiting for you. Again, that's June 26th at Beaver Dam and July 24th in Janesville. Both are from 11 a.m. to 2 p.m. As you may know, Wisconsin is one of 22 states throughout the country that recognize tomorrow, June 12th, as Women Veterans Recognition Day. It was that day in 1948 that the Women's Armed Services Integration Act allowed women to serve as permanent members of the U.S. military. As our fastest growing population of veterans, we want to take time to thank our women veterans on the call for your service and sacrifice. Our staff have been visiting all our clinics this week with women veteran resources. If you haven't stopped by, you still have a few more opportunities. Tomorrow from 9 to 11 a.m., we'll be at our Beaver Dam and Rockford clinics and also at our hospital in Madison. So if you're in Beaver Dam, Rockford, or Madison tomorrow between 9 a.m. to 11 a.m., please stop by and see us. Also, specific to our women veterans, please pass this information on to your fellow women veterans who might be interested. We are offering a free basic self-defense course specifically for our women veterans. This training uses the RAD system, which stands for Rape, Aggression, Defense, which is one of the most widely respected self-defense programs in the country. RAD focuses on awareness, prevention, risk reduction, and practices physical defense skills. It's designed to empower women by giving them options, confidence, and hands-on techniques they can use to protect themselves. 2 of our female VA police officers, both of whom are also veterans themselves, completed the official RAD instructor certification training, so we can bring this training directly to our local veterans. This is a free, full-day course with a max of 12 women veterans per course. Please pass this on to your fellow women veterans who may be interested. There will be lecture-style learning and hands-on practice, and lunch will be provided. The first self-defense training course is on Saturday, August 8th from 8 a.m. to 5 p.m. at the main hospital. Again, that is August 8th from 8 a.m. to 5 p.m. We will start advertising this widely very soon, so if you'd like to sign up, please RSVP by calling 608-256-1901, extension 18422. Again, that phone number to RSVP is 608-256-1901, extension 18422. Thanks again for joining us today, and I hope to meet you at some of these events over the summer.
Thanks, Ms. Kleckner. That's a lot to look forward to over the next few months with nice weather, hopefully. And this is a great time to remind everyone, if you didn't catch it at the very beginning, to check out our Facebook page or sign up for our email newsletters to make sure you're getting updated information on our events. You can find a link to both by going to the Madison VA website and scrolling down to the bottom of the page. Switching gears, we've got some other resources for those of you who are caregivers, use a caregiver, or know a vet who uses a caregiver. Here to tell us more from our caregiver support team is Lindsay Knoll.
Good afternoon. The Madison VA Caregiver Support Program is proud to offer the Caregiver and Family Resource Fair to fulfill the mission to care for those who care for veterans. It's on Friday, June 26th from 11 a.m. to 3 p.m. at the hospital, and we encourage all of you to stop by. Again, that's Friday, June 26th from 11 a.m. to 3 p.m. at the hospital. Our Caregiver Support Program provides support and services for caregivers of veterans with focus on improving their quality of life through education, resources, support, and services. Each year, the Resource Fair brings together VA and community resources while allowing you the opportunity to meet other veteran caregivers. This year, we are so excited to welcome many VA and community members with a wealth of resources available to caregivers and families of veterans, such as VA and Dane County Dementia Care Specialists, Dane County Veteran Service Officers, representatives from VA's My Healthy Vet program, physical medicine and rehab, nutrition and whole health, along with tons of resources from suicide prevention, in-home and community support services, and VA benefits. That date again for the Resource Fair is Friday, June 26th from 11 a.m. to 3 p.m. We will be set up outside in front of the Madison VA Hospital entrance. If it rains, you'll find us just inside the main entrance by the auditorium. There is no need to RSVP to this event. Just show up ready to connect and hopefully learn something new. If you or your caregiver has questions about available resources, please reach out to us at 608-256-1901, extension 11576. Again, that number is 608-256-1901, extension 11576. We look forward to hearing from you and meeting some of you in a few short weeks.
Thanks, Lindsay. We hope to see all of you here for the Caregiver Support Resource Fair. Again, that's Friday, June 26th from 11 to 3. We do 4 all-veteran town halls a year, and today's is focused on our northern tier of our service areas. So to tell us more about what's happening in your areas in the northern tier is one of our clinic managers, Kristen Holm.
Good afternoon, and thank you for joining us. My name is Kristen Holm, and I'm the clinic manager at our Beaver Dam and Madison East clinics. With many of you being in the northern part of our service area, I'd like to provide some updates that may be of interest to you. We're excited to share that if you have billing questions, we now have a specialist on site at the Beaver Dam Clinic who can help you in person. They will be there weekly on Wednesdays from 7 a.m. to 2:30 p.m. to help answer any VA billing questions that you may have. Some of the things that they can help you with specifically include looking at your VA statement that you've received that may include a balance due and how to make payment, how to obtain financial assistance if needed and to help pay your bill. They can help with claims that were billed to your commercial insurance. They can assist you in viewing online options to update your financials or to request a rate waiver for the balance on the account if needed. And they can help you with getting to the correct person to help if it's not them. We appreciate our billing experts taking time to meet with veterans in person instead of you having to drive to Madison to receive in-person help. Again, that's every Wednesday at the Beaver Dam Clinic from 7 a.m. to 2:30 p.m. if you have any billing questions. Switching gears to our individual clinics, we are often asked by veterans when our clinics are open. With most of you being in our northern tier of service area, just a reminder that our clinic in Baraboo is open Monday through Friday from 7 a.m. to 4:30 p.m. For those who visit Beaver Dam, Janesville, Madison West, and Madison East, all of those clinics are open Monday through Friday, 7 a.m. to 4:45 p.m. Again, Baraboo is 7 a.m. to 4:30 p.m., while Beaver Dam, Janesville, Madison West, and Madison East are all open 7 a.m. to 4:45 p.m. Please note that none of our facilities offer walk-in appointments other than our emergency department. If you need urgent care, please call our call center at 888-598-7793. That number again, if you need to find urgent care, is 888-598-7793. Of course, if you have an emergency, call 911 immediately. Lastly, as our director, Ms. Kleckner, mentioned earlier, we're hosting an open house at our Beaver Dam Clinic, and we invite you to grab a fellow veteran and join us on Friday, June 26th from 11 a.m. to 2 p.m. Whether you're already enrolled in VA healthcare or have never walked through our doors, this event is for you. Tour the clinic and discover the wide range of services we offer right here in your community, because you shouldn't have to travel far to get the care that you've earned. On site that day, we will have VA eligibility specialists available to help veterans enroll in healthcare on the spot with no appointment needed. While you're here, learn more about the services we provide, including primary care, physical therapy, nail trimming, yoga, and more. We also offer telehealth services, which allow you to connect electronically with some specialty providers in Madison without actually having to travel to Madison. You can connect from your home or at our clinic, and best of all, you don't have to fight the traffic. And because no good Wisconsin event is complete without good food, if we have good weather, we'll be grilling brats for you. Again, the open house is Friday, June 26th from 11 a.m. to 2 p.m. at our Beaver Dam VA Clinic.
Thanks, Kristen, and thanks to the entire staff and teams at our clinics who continue to support our veterans. We always receive such high praise from our veterans who go there. Next up, as many of you may have heard, VA is going through a 5-year transition to new electronic health records. This rollout was paused a few years ago to work out some kinks, but each new site that has transitioned over to the new system seems to be going better and better. I want to share what you can expect and how you can best prepare for our go-live date this coming January 2027. I do also want to point out that we sometimes get veterans on this call from throughout the country if you had an appointment in our area over the last few years. So I do want to preface this with the fact that this information is specific to the Madison VA Hospital Hospital and clinics. Each area has their own go-live date, which you can find online, and I'll share that resource shortly. Everyone likes to know, what's in it for me? How will this impact me and my health care? Very fair question, so let me share. Once we go live, veterans will have an easier transition from military to VA care. You'll no longer have to manage the transfer of your own records when you separate from the military because they are already in the system. You can anticipate more productive appointments. You'll be able to spend more time talking with providers about your health concerns and available treatments and less time repeating your health history. With our current system, not all VA sites are connected, but with the new system, we'll all be connected so you won't have to repeat your history so often. Please note your first appointment after our go-live date in January of 2027 may be a little longer than typical because they'll want to confirm your health history is accurate. But that is a one-time thing, and we will be reminding you numerous times between now and then to expect that. You'll spend less time undergoing repeat tests, imaging, and exams. With information like test results and records from military and community care providers already in the system, you'll spend less time repeating past procedures and exams. You'll also have improved prevention and treatment options. As this is deployed to more facilities across the country, VA can analyze veteran and service member data more easily, giving deeper insights into veteran health issues and informing innovative new treatments. You'll start seeing a more consistent experience across VA facilities. If you're referred to another VA, it will operate the same and they'll be able to quickly access all your records, referrals, and orders. And you will use one patient portal no matter which VA you visit. This all sounds great, right? And it is. Definitely a change that's been needed. But rolling this out across the entire nation isn't easy. So here are a few things you can do to help with the transition. We can't encourage you enough to make appointments early. There may be fewer appointments available right before and right after we go live in January. So be sure to make your appointments early. We'll also be working with our clinics to communicate this over the next few months for high-risk patients. Likewise, the same is true for your prescriptions. Make sure to refill and renew prescriptions early to avoid potential pharmacy delays as we get closer to January. Please keep all of your contact information updated. Ensure your name, email, address, and phone number is up to date in your VA profile. Sign in, as you probably are doing now, using your login.gov or ID.me account to confirm your information is accurate. If you have changed your legal name and you receive pay from the Department of Defense, you need to verify your new name in DoD's DEERS system and make sure that they match up identical. As always, we encourage you to use secure messaging. If you have a non-urgent, non-emergency question or request for your healthcare team, try secure messaging through My Healthy Vet. If you haven't subscribed to our email alerts, we encourage you to do that once again so that you get updated information. Just search online for Madison VA and scroll to the bottom to subscribe. Also, you can visit the EHR Modernization website for the latest information. Again, that's EHR Modernization, which stands for Electronic Health Records Modernization. All right, our last presenter today is going to share some exciting results from a recent research study. Here to tell us more from our research team is DeRay Coughlin.
Hello, everyone. In recognition of PTSD Awareness Month, I want to share the results of a recent research study, along with some chances to join current PTS research that we're doing here at the VA. Even if you aren't able to participate, please keep it in mind for your fellow veterans. The Madison VA Hospital and Clinics recently took part in the COMPASS study. This study looked at two kinds of therapy for veterans who had both PTSD and substance use disorder. A total of 426 veterans from 14 VA hospitals across the country joined the study, including 40 from our VA. The research team compared two types of therapy to see how well they reduced PTSD symptoms
in veterans with substance use problems. These therapies included trauma-focused therapies, such as prolonged exposure and cognitive processing therapy, which help veterans work through painful memories, emotions, and the meaning of their trauma. Or present-centered therapy, which teaches veterans about common reactions to trauma, helps them solve current life problems, and offers support and understanding. The researchers wanted to see if one of these therapies worked better than the other, and which therapy veterans were most likely to finish. By the end of treatment, both types of therapy lowered PTSD symptoms and reduced substance use. The two therapies worked about the same in how much they helped. However, veterans who received present-centered therapy were almost twice as likely to complete their treatment compared to trauma-focused therapy. If you volunteered to participate in this study, we can't thank you enough. The results from this research will help VA providers deliver the best type of therapy for veterans with PTSD and substance use disorder. The Madison VA Hospitals and Clinics is also currently offering another PTSD research study called Project PORT. Project PORT compares guilt reduction therapy to standard trauma-focused therapy. Later this summer, we will also begin a study using GLP-1 medications to help reduce alcohol use. Please reach out to your mental health provider or the Mental Health Research Office at 608-256-1901, extension 12626, if you are interested in learning more about current and future mental health research studies. That number again for mental health research is 608-256-1901, extension 12626. Thank you.
Thanks, DeRay, and thanks to all of our veterans who participate in our research and making sure that you are helping your fellow veterans. Now it's time to move into question and answers. We have a few questions in our queue, and we'll call your name when you're ready for your question. When we can see your questions on our screen, but we will ask you to repeat it so others can hear it, and then we'll respond. Please avoid disclosing personal health information. We want to make sure we protect all veterans' privacy as we answer your questions. And our first question is going to Joe in Fond du Lac. Joe, go ahead with your question.
Yes, my question was, do or does the VA intend to have some type of dental care for just veterans?
Yeah, hey Joe, this is Abe Rabinowitz. I'm the Associate Director. This is a question that we get a lot because the dental benefit is limited to 100% service-connected veterans. This is something where we really need legislation to support extension of the dental benefit to veterans. So this is something that I know is commonly brought up to legislators seeking to expand that care. But while we can't and don't have an update on the dental expansion of dental benefits right now, we do have people who can help. So one of the outreach strategies you can have is you can reach out to our eligibility department that does have information on some affordable dental insurance plans, and you can reach eligibility at 608-256-1901, extension 17038. Again, that's 608-256-1901, extension 17038. Or you can try to connect with one of our social workers who can try to connect you with affordable dental benefits in the community. So I know that doesn't completely answer your questions, but that's the status of expansion of dental benefits today.
No, thanks for the help.
Thank you. Thanks, Joe. And there were a couple others who had that same exact question that were in the queue, so a very popular question. Just a reminder, if you have a question you want to ask, we don't have a ton in the queue, so if you have a question, just hit 0 and you'll be connected to one of our screeners. Our next question is coming to us from here in Madison. Carolyn in Madison. Carolyn, go ahead with your question.
Yes, I have a question about women veterans and where we stand at the Madison VA right now. I've been coming to the VA since 1993, and there were a group of us women veterans with the United Women Veterans Group who fought to get our own waiting room with our own clinic. And we also fought to get Building 22 1 day a week for just women. And this was because a lot of us feel uncomfortable who are suffering from MST sitting in a waiting room with men. And we just want to sit comfortably and quietly. We had also asked for a wall of honor. It was generic. Yes, it was put up at one time, but that is gone as well. And the wall for the women I stand to has been moved all the way down to the end. You can't see it unless you go to the cafeteria. And also, I wonder who is going to make sure that us women veterans are taken care of at this VA. We just want to be taken care of.
Hi, Carolyn. This is Erin Mullen. I'm the Deputy Chief of Primary Care. I really appreciate your call and your question, and I want to assure you that we really do care and are very dedicated to providing exceptional care for our female veterans here. I know about the request for a women's only waiting room, and unfortunately, due to space constraints here at our main site and at several of our CBOCs, we don't have a individual space for female veterans. What I would tell you is that when you are visiting any of our primary care clinics, if you would like to be placed into an exam room early upon your arrival, that is something that we can coordinate and would certainly be happy to help you with. I'm not sure where you receive your care, but if you're receiving your specialty care at a CBOC site, we would be happy to do that for you. In regards to the women's only kind of Hall of Heroes or Wall of Recognition, I don't know where that stands. I would say that there are, those come through for nominations, and I agree. I would love to see some women veterans up on that wall, and hopefully that's something that we'll move towards in the future.
There's one up there I appreciate. She's a World War II veteran, and back in the day, there were some that were put forth, but your PR person at the time didn't feel that he wanted them up there. And last thing I'd like to say is I'd really appreciate if your people that are checking us in were more cognizant of looking up to see if a woman or a man are standing in front of them instead of just saying, "May I help you, sir?" Because a month ago, I walked into physical therapy and what I heard was, "May I help you, sir?" And I said, "Oh, I'm a female, not a male."
I'm sorry about that experience. I know that we do a lot of training in I'm assuming all of our clinics, but I know specifically in primary care about being sure that we're really forward-facing when patients are coming through and that we're using great eye contact and, being welcoming. And so that's certainly a message that I will communicate out to our staff yet again at our monthly staff meetings. And I think it's a great message for all of us here in the room to hear, and we will continue to push that message out to our forward-facing staff. Thank you so much.
Thank you, Carolyn, for that question. And also, there is a program here that we offer here called Sister to Sister, where fellow female veterans will meet you when you arrive for appointment and escort you and stay with you up until you go in to be seen. So if you're interested in either volunteering or taking advantage of that Sister to Sister program, that number is 608-256-1901. It's extension 13440. Again, 256-1901, extension 13440. So if you're interested in volunteering or taking advantage of it, give them a call. We do ask that you try to call at least 1 week prior to your appointment.
And finally, this is Stephanie from social work. I'd like to add that if you've experienced military sexual trauma, we do have coordinators here who would want to talk to you if you want to talk to them. And so if you could please give us a call, you can call the social work office at 608-256-1901, extension 17085. And again, that's for anyone who has experienced military sexual trauma. Thank you.
Thanks. Our next question is coming from Waukesha. Kathy in Waukesha, go ahead with your question.
Hi. I just wanted to know about urgent care. If I needed to see an urgent care facility, can I go to any facility, and does the VA pay for that? I also wanted to know, do they pay if I'm in another country? And what if I get a prescription at an urgent care facility? How do I get that filled, and does the VA pay for that?
Hi, Kathy. This is Melissa. I'm the chief of the Coordinated Community Care Department here at the VA. Yes, there are over 4,000 urgent care facilities throughout the VA or throughout the U.S. and the U.S. territories. The only one outside of the U.S. territories, I believe, is in the Philippines. So other countries, no, it's just the U.S. and U.S. territories. There's over 4,000, and you can find those, the closest one to you, at www.va.gov/find-locations. Again, that's www.va.gov/find-locations. And Dale had also asked for the urgent care phone number to find an urgent care, and so that phone number again is 888-598-7793. 888-598-7793. So those are the two ways you can find your nearest urgent care to you. And if you need prescriptions at that urgent care visit, you can have those filled at the pharmacy nearest, where they call those in, up to a 14-day supply. Thank you.
And also we have our friends from VBA over in Milwaukee on the call, and Nolan from the VBA office wanted to chime in with some more information too. Go ahead, Nolan.
Hi, Kathy. It's Nolan from the regional office in Milwaukee. We had a incident recently where a veteran was traveling abroad and needed medical attention. There is a VA program called the Foreign Medical Program, FMP, and you can go to va.gov to register with the VA prior to your travel. And I believe you will be able to receive treatment if needed outside of the country, but you must register prior to leaving. So I hope that helps answer the question on the foreign medical care.
Could I just ask a follow-up question?
Go ahead.
The foreign medical program, my understanding was that was only for service-connected conditions, not anything that was like an emergency-related situation.
Yeah, I believe that's correct. But
okay.
Yeah, if you needed any care for service-connected conditions, that's what you would do prior to traveling. And for all veterans, that would greatly benefit you if you do register with the Foreign Medical Program prior to traveling.
Awesome. Thank you, Nolan. Thank you, Kathy, for your question. All right, we're going to go to Jim in Columbus. Jim in Columbus, go ahead with your question.
Yes, this is Jim. My question is about travel. When you're going to appointments and such, why or what qualifications do you need to get travel? Because my total disability rate is about 40%, and every time I've actually gone down to apply for it, you don't qualify. And there's been times that I've been at the VA early before the office or the travel information thing was open, and I remember filling out the form, submitted it, and never heard a thing about it. When I called, they said, "No, you don't qualify for it. You don't qualify for travel. Is there an income limit, a mileage limit, or something to that effect?"
Good afternoon, Jim. My name is Jody Barnett. I'm the travel supervisor. First of all, I'm sorry that you encountered that issue. At 40% service connection, you do qualify for a travel reimbursement, so I'm not quite sure what the details of the travel reimbursement form stated. It could have been just an erroneous error on the system. We do auto-adjudicate via a computer program. I hate to blame technology, but I'm hopeful that it wasn't a staff issue. I look forward to getting your information at the end of this call, and I will reach out personally to you to make sure that I can go through your account, look at the travel claims that you've gone submitted, denied, and kind of walk through those with you and see if we're missing anything for it. And then potentially get you some reimbursements and teach you and show you how to do future reimbursements, who to talk to, what forms to fill out, and the app that we can do it online.
Okay. That sounds good.
Outstanding. Have a great day, sir, and thank you for your service.
Thank you, Jody. Appreciate it. Thank you very much.
Thanks, Jim. Our next question, we're staying here in Madison. Walter in Madison. Walter, well, keep bringing you up here. Hold on, Walter. We're having technological issues. If you can still hear us, you've got a glitch in the system right now. But we will go ahead. I will ask Walter's question for him. He had a question, like to know more about making a complaint to patient relations regarding care. What's the number? What's the process?
Hi, this is Chad Casey. I supervise the patient advocate office here at the Madison VA. Anybody with any concerns about their care here in Madison would like to hear or know about it, and you are free to call our office at 608-256-1901, and the extension is 17182. Again, that is 608-256-1901, extension 17182. And that's with any concern about any care. Even anything within the VA, we usually will know how to route or who is best to contact you. So my apologies if the caller is unable to hear or see that. With anybody on the call, please utilize that number.
Awesome. Thanks, Chad. Sorry, Walter. We had a glitch in our computer there, and it looks like we're back up. If for some reason you didn't catch that information and you need more details, you'll have an opportunity to leave a voicemail at the end of the call, and just leave us a message and we'll make sure we get back to you so that you can get that information. Our next question is Dale in Arlington. Dale, go ahead with your question.
Yes, I guess my question, I wasn't aware of the urgent care number. I got the number. When I call an urgent care number, what happens at that point?
Hi, Dale. This is Erin Mullen. I'm the Deputy Chief of Primary Care. That's a great question. I'm actually going to call that number as soon as this meeting is out and let you know. What I believe happens is that they will, if you're looking for a specific site, they'll tell you where you can go for care. But I'm not entirely sure about that, and I'm sorry.
No, that's fine. It's just, I've always wondered that, if I needed urgent care, because we also have insurance. My wife has insurance through her work, and I've used urgent care through them. but I've never had the opportunity to use care through the VA. So I was just kind of curious how that all works.
Well, now we're both curious, and I'll call after this meeting, and you call, and we'll double check with each other.
Excellent. Thanks for that question. Our next question is Patricia in Reedsburg. Patricia, go ahead with your question.
Yes, Patricia from Reedsburg here. I'm wondering if the VA in Madison is going to offer from mental health the CALMI goal for PTSD and MST, or do we have to go through the mental health clinic to get it? I'm service connected for PTSD, and I recently called and didn't get a response about it.
Hi, this is Sarah Rogers. I'm a social worker and program coordinator for Whole Health, and thanks for your question today. I have a general familiarity with this device, the CalmiGo, though I am not personally trained on it. And you're correct, at the Madison VA, we don't currently work with this vendor, but in terms of what is offered by this device, I think you're going to find a great deal of overlap with biofeedback, which is a service we do offer within our complementary treatments. So biofeedback is something with decades of research validity, where we use breath regulation techniques, learning diaphragmatic breathing, look at heart rate variability. So a lot of those things you're looking at the device you're talking about, and you learn those tools working with a clinician to develop self-regulation skills, manage anxiety. So if you're interested in biofeedback, I would encourage you, if you haven't got connected with our Whole Health program and our Integrative Health and Wellness team, you can call for an intro to Whole Health, and I can give you that number if you've got something to write with.
Yes, I do.
Yep, 608-256-1901. That is the main VA number. I'll give you that again here at Madison, 608-256-1901. The extension is 12537. And then just ask for an intro to Whole Health, and you'll hear about things like biofeedback, clinical hypnosis, meditation. Also, if you're connected with the mental health team, they are huge supporters of the holistic approach to health and well-being, so they're going to be well educated on what we have to offer as well.
Thank you.
Absolutely.
Thank you, Patricia. Our next question, we're going to Platteville. Daniel in Platteville, go ahead with your question.
Hi, I'm Dan in Platteville. I'd like to know why community care will not cover blood draws for me. Whenever I try to get a blood draw down here, I have to travel 80 miles one way, 160 round trip for a 5-minute blood draw. Is there a reason community care will allow me to do that in Platteville?
Hi, Dan. This is Melissa, Chief of Coordinated Community Care again. Lab draws are covered within as a community care benefit if you are eligible for benefits. And Platteville, depending on where you live, if it's greater than that 60 miles, that would make you eligible. If you have not, I would encourage you to talk to your primary care provider and ask them to enter a lab consult for community care when you need that drawn. If you have done that and there's still some issues, leave your name and number after this call, and they will get that to me, and I will call you after the meeting and look at your information specifically, okay?
Yeah, I have community care for dermatology and several different programs. They just don't let me do blood draws, so I have to travel to get it. My name is Daniel Ginty. Do you want my name and number now?
Nope, I don't want everybody on this call to have it, so leave it after the
I'm
call,
sorry.
and they'll get it to me.
Yeah, thank you for your help. I appreciate it.
Yeah.
All right, our next question is Tina in Love Park, Illinois. Tina, go ahead with your question.
Hello, good afternoon, all the veterans and all the veteran helpers. First of all, I want to thank you for all what you do and all what you do for the veterans. But my question is, I just wanted to know, why does it take so long to get travel reimbursement? And the process going to My Healthy Vet is kind of complicated. And is there any way we can make that a little bit user-friendly for us veterans who sometimes have difficulties?
Hi, Gina. My name is Jody Barnett. I am the travel supervisor from NEDA. Thank you for your service, and happy Women's Veterans Day tomorrow. At one point we did have quite a big backlog of travel claims to process. Here at the location we received 331 claims a day to be processed, and those processing is all done by 6 people, 2 full-time, and everybody else is kind of a collateral duty for those claims. So sometimes we do get behind, and for that I apologize. But what I would like to do, Tina, is to talk to you about the My Healthy Vet and doing those through the BTS3. I have a form that I will email and get to you that breaks it down Barney style, as they used to tell us in the military, kind of how step-by-step how we can get that done. That way when you do it online and electronically, you can get it done within the 5-day period. It will automatically process for you. But in the meantime, Tina, I'm going to give you our travel phone number. So if you if you have any more questions or concerns, or if you have some hanging out there that you want to talk specifically about to me, you can call the 256. Okay. Are you ready?
Let me get a pen.
I love it. Sure, go ahead. You let me know when you're ready.
Okay, because that's the only problem that I have with the VA. Otherwise, I love all with the services that they offer. I take advantage of everything.
Amen. I do too as a female veteran. So we're glad to hear that. Okay, so the number you're going to...
I love my provider.
Go ahead. That's outstanding. We love to hear those great things. I'm going to give you my extension, okay? 608.
Yes, ma'am. Go ahead.
608-256-1901. Extension 11919.
119199. It's 6 digits, right?
Close. We're kind of close. Ready? I'm going to give it to you one more time. The extension is 11919.
Oh, okay. Got it. Got it. And your name again, please.
It's Jody with an I.
Okay. All right, Jody. Thank you so very much.
Thank you, Miss Tina. Be blessed.
You too now.
Excellent. Thanks for that question. We got a few minutes for a few more questions. Let's go to Daniel in the Dells. Daniel in Wisconsin Dells, go ahead with your question.
Hi there. I have a quick question. I just, in the last year and a half, became 100% disabled, which allowed my spouse to get on the CHAMP insurance thing. What I'm finding, though, we call, we're trying to do all the things, and she's got her card back, but nothing else is happening, and there's no response. It seems like we're lost in the system. Is there anybody who could help me in Madison?
Hey, it's Nolan from the regional office in Milwaukee. Just want to chime in here real quick. Daniel, did you say you received a card back from CHAMP VA?
Yes, I did.
Okay, so like an insurance card for your spouse?
Yes.
Okay. So that's going to work as a supplement. Say again?
Pardon me?
Go ahead.
But we get, okay, tell me that again. We got the card.
Yeah, so when you get the card from CHAMP VA for your spouse, that's a grant. So all you have to do is submit that card as a secondary insurance or primary, depending on your situation, to the healthcare provider, and they will process it like a normal insurance card.
Not happening. Nowhere. Okay. I guess what I'm hearing is every once in a while somebody does get back to me and say, "Oh, you're not quite there yet," and we have to send them something else. And I know it doesn't work like that. We sent them all of our what we paid for prescriptions, for example, and nothing has happened. Absolutely nothing. That was a year ago.
We'll have to follow up after the call, Daniel. I'm not sure how these what the facts are in this case, so we're gonna have to go over specifics later. We should be able to get back to you later today or tomorrow. So,
well, thank you
we'll talk
very
to you
much.
then. You're welcome.
And Daniel, at the end, you'll have to make sure you leave your name and phone number so that we can call you back. Richard in Oshkosh. Richard, go ahead with your question.
Okay, thank you. One, I'd like to say thank you for what you're all doing for the veterans. I do appreciate it very much also. Two, after hearing the women, yes, take care of them women. And then three, my question is, and not dealing with me, but somebody else, they called the Beaver Dam VA, they were sick. And the doctor, after he told them what was wrong with them, then the doctor says, well, what do you want me to give you? You know, and it's like, well, I'm calling you to get your advice. So if that could be addressed or talked about.
Hi, Richard. This is Erin Mullen. I'm the Deputy Chief of Primary Care. I would love to just give you a quick answer, but what I would really appreciate is if you left your information at the end of the call, and I can follow up with you for some more specifics. We do something called triage patients. So if you call in and you're asking for recommendations, sometimes you'll talk with a nurse or one of our providers, and they can sometimes offer advice over the phone. But I would hate to answer your question incorrectly without some additional information.
Okay, so you want me to stay on the line and then give you my number and that after it's all done?
Yep, there's a chance at the end of the call to leave your phone number and your name, and I will give you a call back.
Okay.
Thank you.
All right, thank you. And thanks again for what everybody's doing.
Thanks, Richard. Thanks for your support. All right, I think we've got time for one more question. Let's go to Laura in Lodi. Laura in Lodi, go ahead with your question.
Yes, hello, and I want to thank all you veterans and all you staff that work at the hospital, first of all, for what you do, and to tell you God bless you and thank you for your service. I also have a question for Jack, the privacy officer. I had called, and the social workers referred me to him or to that office, and I left a message, and to no avail did I get a return call. So that is concerning to me, especially if you think someone has been in your files.
This is Chad, supervisor of the Patient Advocate Office. I'm certainly sorry to hear about your experience. I would like to connect with you after the call. If you can leave your name and number, that would be great.
Okay,
I'd like to get some
thank
more
you.
details on that. And then again, our advocate number for anybody on the call with any concerns about their care or about the VA ecosystem as a whole, please give us a call at 608-256-1901, and our extension is 17182. Again,
And thank you all again.
Yeah, I'm
Thank
going to say
you.
one more time, just for anybody else on the call, the 608-256-1901, extension 17182. So, thank you.
Thank you, Chad. Thank you, everybody, for joining us. Just a reminder, June the 26th, Friday, 11 to 2, stop by our Beaver Dam clinic for free brats and to meet our staff if you haven't, or just to stop by and say hello. We want to thank our friends from BBA on the call for joining us. We also want to remind you tomorrow is Women Veterans Recognition Day, so special shout out to all of our women veterans. And on the 14th, which is Sunday, is the Army's birthday, so happy birthday to all our Army veterans on the call. Thank you for joining us. Please have a good rest of the day.